Hi all. So in this video we are going to see about the basic principles of clinical nutrition. So what is clinical nutrition? Why should we read clinical nutrition, or what is the specifications or difference between the clinical nutrition? And we are going to see about the various screening tools which we are going to use. Okay, so let's see in detail further. So the first thing is going to be the introduction about the clinical nutrition. So what is clinical nutrition? Clinical nutrition is all about the application of nutrition that is being tailored based on the individuals, like based on the individual condition, health condition, or a disease. Okay, it's completely based on a specific condition, that is health condition or a disease. Okay, so when you see specific nutrition or a general nutrition, it is all about like enhancing a specific person's nutrition level, macronutrient level or a micronutrient level, or in order to go with the lifestyle modification. But clinical nutrition is all about it's specifically tailored based on the disease condition. Okay, and that helps us to go with disease prevention and manage the symptoms and to promote the recovery, faster recovery. And that's going to be completely personalized dietary intervention. When it comes to this clinical nutrition, it doesn't mean that when a person comes with a condition, and the same condition you have treated earlier, and you are not supposed to give that same diet plan. You might have various other interlinked conditions as well. So we have to go with a personalized diet plan, personalized dietary intervention, and then we have to proceed with the further protocols. Yes, so this is what is all about the clinical nutrition. So, clinical nutrition will be completely based on the personalization. What is personalization? The word itself states that every individual has a unique nutritional needs and influence, and that completely based on individual's age, gender, genetics, medical history, metabolism, lifestyle, and all this. Okay, so dietary plans has to be customized based on the optimized health outcomes. So, disease management, clinical nutrition is completely a therapeutic diet. Okay, so we have to support the conditions such as diabetes, cardiovascular disease, gastrointestinal disorders, and all this. Diets will be modified based on the nutrient composition, calorie content, and also feeding methods as well. So that has to be met the specific person's requirement. Okay, and nutrient dense foods, which is emphasize the intake of a food that is rich in essential nutrients, that can be like calorie content, or there can be a protein content, or any specific vitamin or mineral or whatever it is. Nutrient dense food is suggested to a patient because you might be deficit with a specific nutrient, right? So that is why we are focusing on, for example, if a person is deficit with the iron content and is undergoing anemia, we have to provide him with iron, right? So that helps us to increase the hemoglobin content. So that is what is all about the nutrient dense. So it's going to be completely personalized, and it is going to be based on the disease, and it has to be based on the specific nutrient requirement. That is going to be completely an individual concern. So next is going to be the dietary modification. So when it comes to dietary modification, adjustments in nutrients, like let us go with protein, fat, or carbohydrates. So the adjustments of the specific nutrients, meal frequency and consistency and preparation has to be. Dietary modification is just not only like including or excluding a specific food, or based on likes and dislikes. No, it's all about like the specific nutrient, and also the preparation method also includes, and the preparation method is based on the clinical condition as well. Yeah, so yes, so that is what is very important. And for example, if they are hypertension, we have to go with low sodium. So those interlinks has to be taken care. And comprehensive assessment, we have to go with comprehensive assessment like anthropometric data, and we have to go with biochemical markers like blood parameters and clinical signs and symptoms and all this. So we have to take care of all the basic parameters assessment, and then we have to proceed with the dietary plan. Before that, we have to even take care of this 24-hour dietary recall and food frequency questionnaire to know how is their dietary pattern. And then what is the role of a clinical nutritionist? So they have to work closely with healthcare professionals, and they have to integrate the nutrition and the overall medical treatment. It supports prevention, treatment, rehabilitation process, and improving the quality of life and medical outcomes. Provides education and counseling for the patients based on the condition, and also to how to manage a specific condition and how to take care of an health. So this is what is all about the role. So they have to work very closely with healthcare professionals. So that is a very important stuff. And then they have to take care of all this treatments and also to take care of the consultations. So whatever it can be, like we providing a diet, just providing a diet plan and going, it doesn't mean that a nutritionist work is done. We have to do with the follow up. We have to see whether the diet plan has been followed with a specific client. We have to give them emotional support rather than just being a dietitian. A clinical dietitian or clinical nutritionist or general dietitian or nutritionist just giving a diet plan and giving is not a rule. We have to go with all this what to say, all this traumas that they're undergoing. They'll just spit out to you like what happened, why am I like this, why my family is like this. Everything they will tell you. We must not neglect and go. We must just sit and listen. We must pacify them. We must make them strong. And then we must say, like, your health is very important and all their importance has to be given. And then we have to inculcate the diet plan, make sure that you're following and all this. And every single day we have to boost them up. We have to motivate them, like follow the diet plan, go with this, why do you include this a lot amount, reduce it in the next meal. And all this follow-up has to be done as a dietitian. And importance of a clinical nutrition: adequate nutrition is a fundamental for the body function and immune competence, wound healing, and energy metabolism. Clinical nutrition plays a very vital role in reducing complications like hospital stays and all this recovery and all this. Okay, so that is been thing. So this is what is all about the basic use and basic importance of a clinical nutritionist and a role of a clinical nutritionist. What do they do, how important it is. So that is the difference between the normal nutritionist or a dietitian and clinical nutritionist or a dietitian. Okay, it's just completely a disease specific. So now we are going to see about the different screening tools. We saw like certain tools earlier with the word no, anthropometric measurement, biochemical assessment, chemical assessment, and all this. So this is also assessment. 24-hour dietary recall, frequency questionnaires. This is also an assessment. Along with that, this is going to be a clinical assessment. Okay, so let's start with this. First is going to be must. What is must? Full form is malnutrition universal screening. Okay, so it's a widely used evidence-based five-step screening tool, which is helpful for identifying the adults who are malnourished and risk of malnourishment, which has been happening. And if they are obese as well, they can guide with an appropriate management also. So this is what is malnutrition. Malnutrition includes less nutrition and overnutrition both. Okay, so it is a five-step screening tool. This must is a five-step screening school, and that is being completely designed for the adults to take care of undernutrition and also the overnutrition. So let's see when to use. Patient, if he is at a risk of malnutrition, according to British Association enteral and parental nutrition. Okay, so based on that we have to go with the screening, and we have to take care of we have to do this process for hospital inpatients weekly. If the patient in a community care homes, it's monthly. An outpatient, if they have any sort of a low risk, not much of risk, it can be go with manually. If they have high risk, it's better that we go with every 3 months. Based on the status, we have to go with this assessment. Yeah. What is certain problems, pitfalls? What are certain problems that we face when it comes to this must? If height cannot be measured for a patient, we can go with the recently documented self-reported height. They generally we know our height. Okay, I am 6.5, 6.2. Okay, so we can go with general admission of a patient. If they tell the height, we can go with the same height. If the patient does not know or cannot report their height, maybe the estimated height level can be done. Like for example, if they look like a person, like they have the same height, we can go with the estimated rough height can be done. Okay, if the height and weight cannot be obtained, use we can use mid circumference, which is MUAC. Okay, so that can also be done in instead of going with BMI. And we have to train the staff correctly in order to score the must, take an appropriate steps by the management in order to what to say, limit the error that has been happening. Nursing staff might turn over an important confounding factor for the must, and simple behavior methods is very important, and encourage oral intake and small portions supplementations has to be done for the patients. So they have to be encouraged for the proper nutrition substitution, and they have to go with the proper treatment as well. The must is generally used in UK. So, if untreated malnutrition, they can lead to poor health and outcomes that can lead to morbidity and significantly reduce the quality of life as well. Okay, so they can undergo with disease and also death as well. So, studies have shown that the patients who are malnourished, access of health services are more often in both acute hospital and primary healthcare center as well. And when admitted patients are malnourished, we can go with the long inpatient stays and high mortality rates might be the cause. So we have to go with the proper nourishment, and the advice and immediate action has to be taken. Routine use of the screening tool can be very helpful in order to prevent from the risk of malnutrition or suffering. So why should we use this must, and what is a scoring method? So now we are going to see about the scoring method. First is going to be measure BMI. So in order to measure the BMI, we want height and weight, right? So that has to be measured. So if the patient is with lesser than 20 kg per meter square, so they are malnourished. Okay, and like for example, if they are with 18.5 to 20, they are almost in the range of a malnourishment. Okay, so if they are very less, like 18.5, they're very less than 18.5, they are completely malnourished. If they are more than 20, they are okay, they are normal in range. Okay, if they are 18.5 to 20, they are near, they are okay. We have to still provide with the proper care and supplements. Unplanned weight loss, like all of a sudden they are getting loss of a weight by 3 to 6 months with no reason. So we have to go with even the scoring. Okay, so that is very important. And acute disease effect. So short term disease effect, how long it is, like maybe lesser than 5 days or something like that. It's not that much, it's not going to be a dangerous. So those based on that. And had score is all about like adding up the scores 1 to 3, determine overall risk factors and all this, and management guidelines has to be taken care. And we have MNA, it's going to be mini nutritional assessment. So that is going to be the tool which is helping us to validate the screening and assessment for elderly individuals, that is like 65 and above. Okay, in order to see the risk of a malnourishment. So MNA, they consist of 18 items that is divided among the categories. Like we have anthropometric assessments, we have dietary assessments, global assessments, subjective assessments, and all this. So when it comes to M&A, can be completed like about 10 to 15 minutes, which is suitable for the clinics and hospitals. So which is going to be a short form process of screening, like less than 4 minutes. So maximum total score is 30 points. So score less than what to say, less than 17 is malnutrition. If they are 17 to 23.5, they are like risk of malnutrition. And if the score is 24 to 30, they are well nourished. Okay, so the tool to be identify the risk of pronounced clinical condition is going to be like weight loss and low serum albumin, that may be the higher indicators when it comes to the malnourishments. Okay, so totally like we saw two different sort of an method. One is must and what is MNA. Must is going to be uh, for an adult. Okay, and that is going to be for the patients, and that is going to be completely for the patients who is suffering from a specific condition. Okay, so it's completely based on a BMI measurements. BMI, it's like both height and weight has to be measured. Okay, and also if they are getting with any sort of an acute disease, Based on that also we can go and rapid weight loss all of the sudden, which is completely unplanned, and they're not going to going any sort of a specific treatment in order to go with weight loss. Unintentionally there is a drastic weight loss, we have to go with checkup. So that checkup has to be must. Okay. And MNA is going to be like completely a short form of an screening, and that can be taken care by maybe 4 minutes or just 10 to 15 minutes. Yeah, so based on the scoring we have to take care. And yeah, so these are the scorings which has been mentioned already. And now we have to go with NRS, which is nutrition risk screening. Okay. And this validated screening tool is recommended for the hospital setting to identify the adult patient which is at the risk of a malnutrition. So they require support, nutritional support. So this particular screening is being focused on hospital adults. So when it comes to this, practically quick, that is like 2 to 3 minutes fatafat work which can be done. And patient's assessment upon hospital adjustment, it's not suitable for the patient or children who is under 18 years. So, what is the very important factors to be considered? Pre-screening, which is four initial yes or no questions has to be asked. So, if their BMI is very less than 20.5, weight loss is getting like this BMI has been reduced. The patient we have found that BMI is lesser than 0.20 20.5, they are in malnourished condition, and we have to ask them whether this weight loss is happening last 3 months. Okay. And we have to ask them whether you had reduced dietary intake and you didn't have a proper diet. And again we have to ask them, you had any severe illness like jaundice or something like that? No. If we have to ask those questions, three questions. First we have to check with BMI which is lesser than 20.5. Second question, we have to ask whether the weight loss is happening for the last 3 months. Third question, dietary intake. And fourth question is going to be on severe illness. We have to ask all these questions. If yes to the all the questions, we have to go with main screen. If no, otherwise we have to go with rescreen weekly. Main screening includes two domains. Each has to be with three scoring. One is nutritional status. So nutritional status based on weight, BMI, general condition, and recent intake changes. Like we have to go with this diet 24-hour dietary recall or food frequency question and all this stuffs. And we have to check with disease severity. For example, increased nutritional needs due to the stress metabolism. We have to add 1 point in all this. If that is what is all about the status, we have to go. So we have to ask four questions. So the four questions, if it is yes, we have to go with the main screening, which is nutritional status, and other is disease severity. Okay, so these are the major treatments that has to be taken care. So when it comes to NRS, it's completely a nutritional screening which is being taking place. So nutritional screening that is being taken place for the hospital setup only for the adults. If the admitted patient is below 18 years, that is not been suggested for those patients. Yes. So if that has been happening, we have to go with the proper screening and the method of questioning. If the questions are yes, we have to go with the main screening, and main screening consists of two methods, which is nutritional status. Nutritional status can be assessed through weight loss, BMI, general conditions, and recent intake changes, and disease severity. If there is any disease recently they are come across, we have to go with that. And when it comes to this NRS, its interpretation, if the score is uh, almost like 3, we they are with nutritional status, nutritional risk. Okay, if they are lesser than 3, we have to go with rescreening. So this is what is all about the various screening methods which we saw. So in this video, we had an intro about what is clinical nutritionist role and what do they do and what is the differentiation between the normal, I mean, dietitian or nutritionist or clinical nutritionist or a dietitian, and how important is the role and all these are factors we saw. And we saw about the three important nutritional assessments which has been taken place in hospitals, especially in hospital. Must. Okay, and we saw about MNA and we saw about NRS. Okay, so these are the three main important assessments which has been taking place in hospital sectors, and that has been suggested based on the malnourishment, based on the BMI assessments, and based on the illness that has been happening recently, And also along with, we have to take care whether they have lost the weight just past 3 months. If that is happening, they have some disease that is being interferent, and they are not having any sort of a diet restrictions or something like that, they're going with a normal diet, it's a high call for them. Okay, so these are the certain concepts in this video. I hope you people would have understood this video. Thank you for listening the entire lecture, entire video. So this is what is the concepts to be explained for the today's session. Thank you.